Hello and welcome to this week's episode of Giant's Healthy Innovators Live TV. I'm your host and my name is Barry Shrier, and I'd like to say thank you to the many tens of thousands of viewers who tune in to watch our weekly episodes featuring some fabulous innovators and scientists and academics and business people who are all at the forefront of creating the latest healthcare technology innovation and improving healthcare all around. To begin with, I'd like to say thank you to our sponsors. We have Grovelands, who are an international management consultancy and recruitment business. Thank you to Grovelands for your support of Healthy Innovators TV. And we also have Tech Data, who are a global IT distributor and support company. So thanks again to Grovelands and Tech Data for your valuable sponsorship. We appreciate that. I would also like to mention that these episodes are sponsored by the Giant Health event. Giant is Europe's largest and most established healthcare innovation technology event. We gather thousands and thousands of people together every year, and this year the event is from the 15th to the 16th of October here in London. So if you're involved in healthcare or technology or innovation, we'd love to see you. The website for a Giant Health event is www.gianthealthevent.com. So we look forward to hearing from you. So this week we have some fabulous guests. Thank you very much for joining us, Keith and Bijendra. Nice to see you guys. As you know, the format is I'd like to ask you guys to introduce yourselves, please, and to talk a little bit about what you're doing and what some of your interests are in healthcare. And then we're going to have a general conversation about how to move forward with adopting new innovation, how to accelerate healthcare to deliver better outcomes. We all share one vision, which is to improve the health and the well-being of people around the world by supporting innovation and facilitating health tech entrepreneurs. So it's great to have you guys on the show. Thank you very much. So Keith, please, if you don't mind, if you can introduce yourself and tell us a little bit about what you're doing.
Sure. Thanks, Barry, and thanks to Giant. It's great to be here. So I'm Keith Errey. I'm the CEO and co-founder of Isansys Life Care Limited. And Isansys is a business where we are really automating one of the basic processes of healthcare, and that is knowing what a patient's physiology actually is, what their physiological status is.
Excellent.
In the hospital, it's called taking OBS, and that is done either by nurses working manually or sometimes done with machines by the bed. And what we have done is not only automate it, but make it wireless, so patients can have all their data taken all the time and be totally free, be totally able to walk around without the tyranny of cables and wires.
That's superb. Yeah, great accomplishments, and congratulations on what you've done so far. So the company's called Isansys.
Isansys.
What's the website?
So we're isansys.com.
How's that spelled?
So ISANSYS.com.
So for example, if you're a patient in a hospital and the nurse puts that little thing on your finger, like those types of monitoring devices, but more advanced?
Well, we use that kind of monitoring device because that's measuring your oxygen saturation in your blood, and that's an important vital sign. So the system we make is able to take 5 major vital signs, which is heart rate, respiration rate, temperature, blood pressure, and oxygen saturation.
Right.
But on top of that, we allow nurses to add in some of their own information, because this system is building up to something which is called NEWS, or the National Early Warning Score. And NEWS has at least one nurse-reported parameter, which is a patient conscious or not? Wow. And there's a scale by which a nurse will make that judgment, and then she can just tap it in at the bedside, just on a tablet, on a screen, and wards become paperless overnight.
Wow, that's fabulous. Well, thank you very much for the introduction, and very keen to hear more about that during this episode. Thank you. And I'm glad to have you on board today.
Thanks.
And Bijendra, nice to see you. Haven't seen you in weeks, have I?
I know. We were not so long ago in Sofia.
Exactly. Yeah, anyway, but thank you for joining us. So if you could help us to introduce you and let us know what you're doing these days.
Yes, thanks for inviting, first of all, Barry, and thanks for Giant. I'm an NHS consultant, as you know, and academic surgeon. So my role is clinical practice as well as university education.
Okay.
And I'm also medical director for a startup tech company called Medical Realities.
Oh, okay, excellent.
Which is where we are using technology to disrupt surgical education. It takes about 15 years to train a surgeon.
Wow.
And in any medical school, you can have 3 or 4 medical students attending an operating theatre to watch me operate and learn.
Okay.
So you can imagine if it takes 15 years to train a surgeon, if we have to sort of improve our workforce training and education and efficiency,
Yes.
it is going to be challenging.
Yes, absolutely. And I guess it's not scalable, is it? If you have 3 or 4 students who are in a theater watching you, how do you do that times the requirement for training many thousands or tens of thousands of students?
Well, the answer is virtual reality.
Yes.
They can
So this
do
company is called Medical Realities. And do they have a website?
They have it's
medicalrealities.com.
medicalrealities.com.
Okay. And tell us some more about that, because that's fascinating.
So what we are doing is we are recording the entire operating theatre and the procedure in VR.
Okay.
And using your mobile phone. So all you need is download the Medical Realities app on your mobile phone.
Right.
Any VR headset you can put it on, and you can straight away enter the operating theatre.
Wow.
So any number of people can enter the operating theatre and
Yes.
learn from expert surgeons. So
Any number.
Any number.
So you could have 25,000 students overseas participating in this exercise.
I think the global, if I'm right, the global mobile phone penetration is about
2 or 3 billion or more?
So they can all tune
Yes.
in.
Magnificent. Yeah. That's the promise of technology,
That's the
I suppose,
technology.
is technology,
That's the
is scalability. But there's challenges, aren't there? So for example, with your business, what kind of challenges have you been experiencing in your journey?
Well, I think it's actually related to what we've just heard from Bijendra, that the time it takes to train somebody in the medical profession, particularly a doctor or a nurse, is very long. So it's quite difficult to come along with new technologies and then expect people who've had 10, 15, maybe more years of training to throw away what they were doing and adopt something new.
Yes.
And because, in a very real sense, we as patients or as healthcare consumers are giving those people life and death decisions over us.
Yes.
So it's quite serious stuff. So it's not easy then to say, I'm going to try something new.
Sure.
And relate.
It'd be a bit scary as a patient, wouldn't it?
Oh, very much
If the clinician comes in and says, well, I haven't used this widget before, but I'm going to trial it on you.
Exactly. But if that new widget is able to be part of a VR-based training program, for instance, things like that will be able to speed the adoption of new technologies, which will be fabulous. Yeah.
Excellent. No, very exciting.
Yeah.
Exciting, but of course, we have these concerns. We have the legacy issues of medical education and the challenge of resources and that type of thing. Where do you see the future in terms of adoption of your types of technologies? Is it equal around the world, or are you finding different experiences in different environments?
Yeah, healthcare is delivered differently and paid for differently in every different country. And that's also a little bit of a challenge if you're a relatively small business and you're operating globally. So you need to kind of get your head around this and you need to work out some business models at work. So that's one of the things. But we do find that certain places are able to adopt technology a little faster. So we're doing quite well in Scandinavia, and that wouldn't surprise anybody that the Scandinavians can do this.
The tech mentality, that
but
kind of thing?
maybe more surprising is that we are also doing very well in India. There's a big pull through in India. And I think what we're seeing there is that this is new technology and it maps very well into a whole new digital paradigm, if you like, that is really being practiced a very wide scale in India.
Yes, yeah.
So,
that's fascinating.
Interesting stuff going on there.
Oh, absolutely. And this concept of digital paradigm, I'm not sure how old you guys are, but I'm very old, and I guess I'm, a digital foreigner. And the youth of today are the digital natives, aren't they? They grew up with smartphones and whatever. And so this concept of digital paradigm, I guess, could be coming on stream. Maybe young medical students these days are a little more familiar with these technologies than the elder senior consultants, and I don't know if that will have an impact. Is medical education quite diverse around the world, and is there a role for immersive technologies to level things out or to create greater opportunity there?
Yeah, I mean, just like medical practice, the medical education is quite diverse.
Okay.
And one of the reasons why it takes so long is it's still classroom-based education, lecture-based education.
Right. Old
which
school.
Which is old school.
Wow.
Not engaging, not immersive. I'm sure we all know what we do if you're sitting in a lecture room.
Yeah,
Sort of
I used to
playing
sleep
with
when I was at uni.
You're either sleeping or now you're sort of on your phone.
Yeah.
So we thought, why don't we use the mobile phone
Right.
to educate people and immerse people?
Yes. And
So, if you look at the learning pyramid, your knowledge retention from lectures and reading is about 10 to 15%.
right.
Whereas if you're immersed in education, your knowledge retention is going to be about 50, 60%.
That's
So it's a
extraordinary.
no-brainer.
It's a huge difference.
No-brainer.
So for the average student, if they're using whatever, virtual reality goggles,
Yeah.
they're going to learn 3 or 4 times more in
Faster.
terms of retention
Faster.
than if they're reading or sitting in a lecture room.
Correct.
That's profound.
And not only doctors, I mean, the whole equation translates into faster education within healthcare.
Yes.
So whether it's doctors, nurses, allied professionals, you can really speed up and disrupt the old-fashioned lecture-based education.
Yes. And I suppose, what's the word for it? Upgrade it.
Upgrade.
Like with a
Upscale.
Tesla car, you can just upgrade it
Upgrade.
over the air
Yeah.
instantaneously. Whereas with an old automobile, you can't do that. So maybe with educational programs, they can be instantly
Just instantly
upgraded.
upgrade that.
Yes, fascinating. No, it's to me, it's a really exciting future, albeit plenty of challenges. And in terms of some of the technologies that you guys have developed, I mean, would you call yourself what? Is it an intellectual property business? Are you a hardware maker? Are you a service provider?
That's a really interesting question, because one of the challenges we face, we do all of that.
Okay.
And what we found is that we make hardware, we design and make hardware, so
Right.
we have smart patches, like stick-on smart patches.
Right.
But in order to make that work, we have to design that at the system level,
Right.
and the system itself becomes a new kind of medical device.
Right.
So the medical device now and the regulated product includes things on the body, a bedside monitor or a monitor unit, which can be in a patient's home, by the
Yes.
way, but a monitor unit locally,
Right.
which is then connected to the cloud server.
Yes.
And all of that is something then that is as I say, there's a regulated medical product.
How
And
extraordinary.
that means that we have to take into account the fact that we've got wireless connections, because wireless connections are inherently unreliable in
Sure.
a way, right?
Yeah.
So we have to take that into account. We have to decide whether we go for data immediacy or data optimization, or continuity, if you like. So we make a decision on that. And that then gives us something that means that we control the quality of the data,
Right.
which we can then hand over to the clinicians and the nurses.
Right.
Because we have to make sure it's damn good. And
Whereas-
that's really what we're focused on.
Yes, exactly. No, that's a
Yeah.
really helpful clarification. Whereas if you didn't have this, what do you call it, vertically integrated scheme,
Yeah.
if you were only a player in one part of
Yeah.
that system,
Yes.
the quality control would be a challenge for you, or the delivery reliability, like if you were only making the patch and
It's-
not doing the wireless software or not doing the box next to the
It's
patient.
delivery and reliability. What we've found over the years, and I've been doing this for about 16, 17 years in wireless patient monitoring.
Wow,
Yeah, a
so
long
it's slowly
time.
getting used to it.
Yeah, so it's I saw it a long time ago. It's
Yes,
taking the
fabulous.
rest of the world a while to catch on. But but the idea of plug and play isn't really tenable at the moment. There has been attempts at doing things like defining interfaces and so on.
Okay.
But there's some real key technical subtleties that make that difficult to play out. The other point, though, is that the other real question, who is responsible for the data when it's given to the professional to make a clinical decision,
Okay.
right? And if you just make one part of that, whereabouts are you sort of then saying, you're declining or just giving up, abdicating your authority or your responsibility
Yes.
for the data?
And that's complicated and perhaps could hold you back in terms of the progress?
Well, it's complicated in the sense that somebody needs to take responsibility for it, and
Yes.
regulators are now focusing more and more on that. If you have a data collection or data delivery system, show us that you're going to deliver good data.
Okay. And therefore, if you own the whole system,
Yeah, and
Then
we
that's
didn't
much
really set
easier.
out to do that. But
Okay, 'cause it's
but-
fascinating.
Yeah, but
Yeah.
when we started to put it all together, we realized that
Yes.
only a system level view and thinking was going to produce something that was going to be clinically usable and scalable.
Yes, yeah.
Scalability is a big,
That's
big
absolutely
issue.
fascinating, because I suppose there's the permanent discussion raging in strategic management about business concepts and approaches. Should you go vertical or horizontal? And Apple is famously a very vertically integrated business, and other players are much less of that. And I remember one of the early digital pioneers, Alan Kay, who invented Windows, said, if you don't own and control the hardware, you'll never make the software do what you want it to do fully. And so there's some issues there which I think are absolutely fascinating. With medical realities, it's more of a player in a bigger ecosystem. You're not making goggles.
We are not making
or,
goggles. No, I think
is it a content business? How do you define it?
It's a content business. So recording, let me give you an example how we've sort of reached here. Surgical simulation, so training surgeons using simulators, box trainers, simple cheap simulators. Now, laparoscopic surgery, as you know, your keyhole surgery, you make tiny incisions in the abdomen, put in a camera, an instrument, then you're looking at a standard flat screen monitor and operating it. So
we should have done a demonstration.
We could have done that, exactly, next time. But now if I tell you that, obviously you know the benefits of laparoscopic surgery, it's less pain and early mobilization and cost effective and everything else. But the limitation is that a surgeon is looking at a flat screen monitor which is 2-dimensional. And your human anatomy is so complex in 3D. So the first thing that you have to learn as a surgeon is to sort of give up all the 3D knowledge.
Because you're looking at a screen.
You're looking at a screen and you're working with long instrument. So about 15-20 years ago, the surgical education, as the laparoscopic surgery began to evolve, and as the training got more and more sophisticated, we realized that we don't need to learn on patients, we don't need to learn on humans. Hand-eye coordination, depth perception, all this you can learn in a simulator.
Oh, how extraordinary.
So just like flight simulators, I mean, you don't fly a plane straight away. You sit in a flight simulator, and that's how it started. Now with medical realities, we are recording the whole operative procedure. And as you know, the surgical training is still an apprentice model where you see and watch a senior surgeon and you learn from them, and then you sort of get your hands dirty, so to say. With technology and haptics, so we have to integrate haptic gloves, and you can actually virtually start doing things.
Amazing. That's fabulous.
So you can see how well you could be immersed in an operation, even as a novice.
That's superb. Could you help our audience, because we have some terms sometimes which aren't necessarily things that everybody who's watching the show will be aware of. You mentioned haptics, so if you could define that to people who haven't heard about that before.
So touching and feeling. So in the simplest form is to be able to touch and to be able to feel. When you're doing operation, it's quite critical to be able to touch and feel the organ. And when you're operating without haptics, it's almost like sort of working in 2 dimension with a lot of limitation and no touch and feel. So making your whole job held back, making it a lot more risky.
And what is a haptic glove, and how does that work?
A haptic glove, you'll sense and you'll feel the simulated body and the tissue that you're trying to handle, where you're trying to operate. So it'll be a very realistic feel in a virtual space.
Fascinating, absolutely fascinating. I guess the latest smartphones have a slightly more advanced haptics than the original ones. First you just had vibrate, didn't you? But now I kind of feel a sort of left-right vibration and things like that, which is fascinating, isn't it? And it's just another layer of information or another level of communication. This has, I guess, a couple different kinds of buzzings or zappings. Of course, I ignore them all, especially when it says every hour stand up and breathe, and all these other healthcare nudges which aren't quite there yet. Are there any issues for you in terms of, I was just reminded of the big global players, what are they called? FAAG, the big largest tech companies in the world that seem to be in control of everything now. Does that impose itself on you guys? Are there risks that, who knows what, Facebook or Amazon or Google might say, well, we'd like to do what you're doing. We think we'll just push you out of the way. or is it so specialized? What kind of issues do you find in that area?
There's always risks. There's always risks, and I think anybody who's working in tech needs to be aware of that. But I think what we have done is, I don't think where we are in the sort of pyramid or triangle of care is going to be where those guys go.
Okay.
So if you look at the triangle, can be drawn in various ways, but we have tertiary care, sort of top of the triangle. That's like critical care in a hospital. You have secondary care, which is like clinical care under that.
Yes.
Primary care, everybody's aware of primary care, your GP and so on.
Yes.
And then there's this other new, really interesting area that you explore often on this show, Barry, which is consumer healthcare.
Yes.
And that is very much bigger. So in terms of numbers, you have like numbers where expanding towards the bottom of the triangle, right?
Okay, and those global players.
And the global players are there because the numbers are big.
Yes.
And the other interesting thing about that is that the further you go towards the top of that triangle, the more difficult it gets, the more regulated it gets, and it's also a smaller market.
Yes.
But it's a higher margin market, and
okay.
it works better to approach that if you're a smaller company than to try to go straight into that big consumer health market, as a player.
Oh, that's fascinating.
Yeah, so it's about thinking about how you structure your business with the technology there.
No, that's a helpful clarification. Thank you for that. There's that graph, isn't there, about the different types of medical care one would get, like primary and then secondary and then whatever, emergency or critical, and the cost of that.
That's right.
And how naturally in society we want to move people as much as possible away from expensive acute care to long-term look after your own care.
Absolutely.
And I suppose maybe there's a little bit of analogy in medical education. Anything we can do to figure out how to reduce the costs of medical education are similar. So you want to move them from that top left expensive corner of the chart to the bottom right inexpensive corner. And again, perhaps this is where things like immersive technologies have a big role to play. It's not the, what do you call it, the apprentice model, which is, I assume, the most expensive.
Most expensive and not scalable, longest. In terms of delivery of healthcare and education, by combining technology and machine learning, you could provide a lot of your basic healthcare. I mean, what do we do today? Most of us, before we see a doctor, we Google.
Exactly. Yeah.
So once we have an intelligent Google who can be your doctor, you will have everything at your fingertips.
Yes, that must be very difficult for clinicians. If a patient says, well, I know what's wrong with me because I've Googled it, and the clinician says, well, I've had 25 years of expert training and experience in this.
Well, in fact, in my practice, I first ask them, what have you learned on internet? So
really?
Tell me. Well, so that I can counsel them better. So I know where they're coming from. I know what sort of ideas they have in their mind.
Okay.
So
yes, the good and bad of technology.
The good and bad of technology. There's no point in shying away.
Yes.
It's there. We have to face it.
Well, exactly, and that's not going away. In fact, it's probably the opposite, isn't it, in terms of the impact of access to information and consumer engagement and that type of thing.
And could those systems be used for consumer training as well, like us as consumers, as just ordinary people? Can we learn more faster about how to look after ourselves in that way, do you think?
Yeah. I mean, I'll give you another example, basic life support training. I mean, you must have heard it in the news recently that they want even the London taxi drivers to be competent and trained in basic life support.
Yes.
And if you, or if anybody had a heart attack on the streets in UK, your chances of survival is about 10%.
Oh dear.
Whereas in Denmark, it's 40%.
Because
it's, as you mentioned, education right from the primary school level.
I had no idea. That's fascinating.
And even the Department of Education in UK has recommended basic life support education and training from school, primary school, secondary school. Now, virtual reality is where we step in. If you
Okay.
yeah. So there's a virtual
As an educational
as an educational tool. It's immersive and engaging. So we have a virtual reality basic life support training
Yes.
model, which takes 20 minutes to train. Whereas if you go to attend a course, it takes 4 to 6 hours of your training.
It's a whole
Half a day or whole session.
Yeah,
so
big
over
commitment.
here, you would get just like playing your Xbox or any video game.
Amazing.
You get the kids into VR environment, teach them basic life support.
Yes.
Don't need to go to medical school. Don't need to do anything.
Yeah.
And you could suddenly improve your survival from 10% to sort of 40% if you want to have
enormous.
That's huge.
From 10% to 40%.
Yeah.
And could that happen with one 20-minute virtual reality
Well,
session,
it's
or
repetition.
series of them?
Series of them.
Yeah.
Yeah.
And what would that include? What are some of the basic life support or
It's just sort of having your
The
compression,
ABCs,
compression only resuscitation.
And that's
we call
all?
it. That's all. So if somebody were to collapse, all you need to do is obviously make sure that the environment around you is safe and start compression. So that knowledge and training you could get in 20 minutes using a VR headset.
Extraordinary. Therefore, accessible to everybody.
Exactly.
And a huge impact on the well-being of the nation.
Yeah.
What a great story. So we've spoken about a bunch of extremely interesting subjects, and we're going to wrap up now. But it's been absolutely fabulous to have you guys on the show. Thank you very much. And I'm also grateful for you to share with us the extremely interesting and important tech innovations that you guys are developing. So what we'll do is I'll just ask you, if you don't mind, to give a little 1-minute summary approximately of what you're doing. Do you have any ambitions, any requirements regarding your business that you want to share with the audience? Or if you just have a healthcare vision of the future, where are we going? Where do we want to be 5 or 10 years from now? So Keith, if you don't mind, if you want to share anything with us, or just a little summary of what you guys are doing would be fine.
Sure. Well, my healthcare vision of the future is related to running a business like this, which means that I'm fundraising, always fundraising.
Yes.
So that's an important part of what we're doing.
Brilliant.
And
so
where
you're looking for investors right now?
Looking for investors, talking to people in various places.
Seed, Series A, Series B?
It's more like a Series AB.
Okay, excellent.
So, because we've been around for quite a while.
Yeah.
And what we're trying to do there is to be able to bring this technology to more and more patients.
Excellent.
And more of the nursing staff, particularly because it's extremely efficient. It really, really makes it easier and better for the nurses. They have time to care.
Excellent.
They're not doing all this other stuff all the time.
That's magnificent.
Yeah.
And you have incredibly strong product and proven traction.
Yeah.
So from the investor's perspective, it's a superb bet.
Well, we think so.
Yeah. I've got a 20 quid if I can maybe buy a...
Absolutely.
Yeah.
Well,
No, but thank you very much. Really interesting. And
thanks, Barry.
we're grateful to have you on board, and also very proud of what you guys have accomplished, a valuable contribution to healthcare.
Thank you.
So thank you for that. And likewise, Bijendra, if you want to summarize with anything or
Well,
vision of the future, what are you guys
in
looking
terms of
to do?
vision, I think what Keith is doing is fantastic, and won't be long before you'll have lots of medical devices or appliances integrated into, you might walk into PC World and just sort of buy a medical pod.
Yes. Yeah.
That will
Which
do your
would be
initial
superb.
assessment and diagnostics. In terms of my personal interest and ambition with medical reality and education is to democratize. So change
Nice.
the way we select and train medical professionals.
Yes.
It should not be just based on 3 A stars.
Yes, exactly.
So,
which arguably could be quite an elitist system,
Yeah,
couldn't it?
yeah, it is. It should not be a privilege for few. It should,
Yes. Yep.
democratize the whole process.
Yep,
and
exactly.
disrupt using technology.
Yes, and immersive technologies actually have a very central role in delivering that, in allowing us to achieve that very attractive destination.
Yeah.
Yeah.
So I mean, through medical reality, we are at the stage of creating a virtual university, if we can call it,
Wow.
and looking to attract funding so that I can have a completely disrupted pathway for medical education. Similar to the new technology engineering college, which exists in Herefordshire.
Yep, exactly. What a great story and a fabulous ambition. So thank you very much for sharing that. Again, great to see you guys. And we're grateful for you joining the episode today. So thank you very much. Once again, my name is Barry Shrier, and you've been watching this week's episode of Giants Healthy Innovators Live TV. We'd like to thank our sponsors once again, Grovelands and Tech Data, and we're also very grateful to Disruptive Live, who are the world's best television production team. Thank you to the team here at Disruptive Live. We appreciate your support. Lastly, we'd like to thank our sponsor, Giant Health. So Giant Health produces Europe's largest and most valuable international event celebrating health tech innovation. The Giant Health event brings together many thousands of people from all across Europe and all around the world who are all actively involved in innovating in healthcare to deliver better healthcare outcomes. This year, the Giant Health event is from the 15th to the 16th of October in London, and the website for that is www.gianthealthevent.com. So if you're interested, please visit the website and you can learn more. Thank you very much, and we hope you enjoyed this episode. Looking forward to seeing you next week.